Dr. Rhodey, see if we can get going. Okay, thank you guys so much for letting us come in again today. I hope you guys enjoy the burritos. I carried that box as the heaviest box of burritos I've ever carried in my life. But no, we really appreciate it. Heard you guys are doing really well on forward booking. Yeah? Congratulations. Yes. Just a percentage, since you are the forward booking queen, you're not looking at me.
I jokingly frowned myself earlier,
yes.
so listen to me.
So what percentage do you think of your annuals that are coming? Are we doing annuals too, or is it, I know we're doing Librella, Silencia, those things?
I'm asking everybody.
Perfect.
For all things.
Awesome.
Bailey, you want to just come back?
Follow-ups,
Yes.
everything.
Perfect. Now is that making its way all the way through the clinic and all the way back? So are technicians talking about forward booking? Are the doctors talking about forward booking? When everyone is on board, you're going to see it really take off. So just keep it top of mind, keep working at it, and things will get better and better, for sure. So we're lucky we got Haley back in here again today to go over the power of the recommendation. Talking, say it strong. Perfect. You guys don't, I mean, I'm sure you realize, but it is super important that strong recommendation. They come here to see you guys because you're trusted advisors to them for their pet, and they really want to hear what you guys have to say. So if you say it in the right way, they're going to believe it and they're going to do it. Okay, so say it strong. I really don't want to take any more time away from Haley, but thank you guys so much for letting us come in and do this again today. We're here for you whenever you need. If you guys need anything for your pets, please feel free to ask me or Tina. We can take care of that for you guys. But yeah, thank you so much, and we'll give it to Haley.
Yay!
Hi guys, my name is Haley, as Brian said. I'm a veterinary workflow specialist with Zoeitis. I'm going to give you a little bit more background as to what my background is in just a second, but I just wanted to ask here, I know I've seen a lot of you before. Do we have every role represented in the room, like techs, receptionists, doctors?
All but kennel.
All
we
but
have-
kennel.
We have some people who
She's
double.
ACA as
She
of
was
today.
As of today? Okay, that sounds like a big deal. Congratulations.
Thank you.
So we're going to talk about Say It Strong today, which is really, like Brian mentioned, the power of the recommendation. So before we dive in, I just wanted to ask a quick question. We all talk with clients, right? Yeah. And we all go over treatment plans. We all already make recommendations, right? So has anyone here ever experienced like feeling uncomfortable in a room or in a conversation with an owner where you started to feel like you were selling as opposed to recommending something? Sometimes?
Kind of.
Kind of? Can you give me like a little bit more detail there as you're taking a giant bite of Chipotle? Perfect timing.
Oh, yeah.
Oh, sorry, hold on. I think it really boils down to client reception. Like if they're just glazed over and like you go to like just finish it up and be like, yeah, we'll move on. That's when it kind of seems more like a car salesman versus actual recommendations. But
Are you talking about like the wellness packages?
no, I'm just talking about anything in general. When they don't want to listen, it kind of does feel like they're a car salesman, not necessarily trying to help their pet. More in fact that they just don't. They're not giving that attention. Thank you. Yes.
So it's almost a disconnect of feeling like, are we on the same team here, or am I trying to get you to do something that you don't want to do? Like that kind of
Yeah, I would
feeling?
say that describes it pretty well.
Yeah. Has anyone else experienced feeling uncomfortable talking about like a treatment plan or finances?
Yeah, especially when they say that they're tight on money.
Yeah.
It's really hard, especially when you're like, well, we would recommend getting this and this, and then they're like, I've already sunk in X, Y, Z amount of money. And it gets really uncomfortable.
Yeah, I have $5.
Yeah.
What are we gonna do here?
I don't even know if I can afford this treatment today.
But let's add on a nail trim.
Always. And there's anal bone expression too.
Oh, yeah.
I didn't give the GABA or the trazodone.
Oh my gosh.
So I don't, like, it's kind of funny to think about. It's something that we all deal with in vet med, right? Like, this uncomfortable conversation happens every single day in almost every single appointment. That's just how this works. And I love kind of opening the conversation about it, but it also does wear you down, right? Like, as someone where in your heart, you know you're recommending, either representing what the vet is recommending as best medicine or what you truly believe is as well. Getting told no over and over again is really like, it's water on rocks, right? Like, over time, we know that this field suffers with burnout and compassion fatigue and decision fatigue. It's difficult. It's really, really difficult. So my background is that I was a vet tech for about 6 years in what feels like a past life, like forever ago. That's me and my soul dog, Marcy, when she was still a baby there. I was a tech supervisor at a clinic in Austin. I also worked ER, GP, specialty blended practice in Berkeley. I did all kinds of stuff. This is me and a dog named Tony Hawk. Does anyone want to take a guess why his name was Tony Hawk?
Is he skateboarding?
I
Did he get hit by skateboarding?
So we're going down the right dark path there.
Oh, no.
He was actually picked up by a hawk.
Oh my gosh. That was my
He's
guess.
fine. He's fine now.
Well, that's good, as long as he's
I think I don't know what we were doing. He's on drugs in this picture, so he was really comfortable. It was a long orthopedic case that I got to be involved in. But I was a tech for about 6 years, so please know that I know how hard this job is. Obviously not from a veterinarian lens, but just through the field in general. You guys have one of the hardest jobs out there. This field is really not for the weak, and what you guys are doing is you're bringing patients the care that they deserve when they need it. That's huge. So please, even if you get yelled at by a client today or bitten by something or there's like pee in your shoes, started a lot of days that way, and there's always UTI pee as well. Just please know, I appreciate you, Brian and Tina, your whole Zoeitis support ecosystem. We know what you guys do. So we can't always empathize, but we can always sympathize. So please know you're very much appreciated in all facets of what your job entails. This note on this side here, I'm going to read it to you. It's super small, but it says, "Dear Haley and Rachel, thank you so much for putting down Poppy safely and kindly. Not only did you do that, you wrote a note too. It really means a lot. That was my first pet death, and you guys made it so much nicer. Thank you, Tyler." So this was a note that a doctor and I got in probably early 2018. Tyler was a 10-year-old boy who came in with his mom for an exam for his pet rat Poppy. And unfortunately, Poppy was not doing so well, and we did have to euthanize her. This was from 2018. It's now July, right, of 2025. I still read this note. I have it favorited in my photo album. I look back on it, and it reminds me every time that, yes, this field can be really sad, but also the impact that we all can have. I think we forget that as a field. I don't know if anyone in here routinely thinks about, gosh, I wonder what kind of impact I'm able to have. It's something that can slip through the cracks. So as we kind of go through what a strong recommendation can sound like, we have to remember what power our words hold and the impact that you can have on people like Tyler, right? And sometimes that recommendation might be something hard, like euthanasia, right? It's not always going to be easy to discuss, but it still has to happen. And we want to have conviction and know what words to use to really get our point across in that conversation. When I think of saying it strong, I also have my own story with this. My dog, Marcy, here, she's tattooed on my arm. That's how deep this love goes. Yeah, I see a lot of people with tattoos in here. I love it. Marcy, like I said, is my heart and soul dog, but she was diagnosed with bilateral elbow dysplasia when she was 7 months old. So she's been, of course, a little bit of a lemon. There's other stuff with Marcy, but I was a tech, so that's what I can expect, right? But as she's gotten older, her limping's pretty under control, but I just kind of treat when she was painful, and I just really have never come back to revisit that until I became a Zoeitis rep, and we launched Umbrella, right? In my head, she's not limping, so she's 7-ish, so she's getting up there, but she's not, I turned into a client, you guys. I was like, she's not limping, she's doing fine.
She's not falling apart.
No, not yet, right? Like, great, she's eating, right? She's not crying. I turned a little bit into a client. And so I was talking with my coworkers about, you know, I have this big dog. I wonder if maybe should I bring her in for an exam for Librella? Like, what do you think I should do? And they're like, did you do the checklist? It's like, no. They're like, oh, you should probably do the checklist for your dog, Zoeitis rep, right? So I did the checklist. Marcy's now on her 80th injection. Completely different dog. But if I had not had that strong recommendation from my colleague, my coworker, I probably wouldn't have brought Marcy in. And she would still be in pain at home as the dog of a previous vet tech with a Zoeitis rep, right? So again, there's a lot of power in the words that we have. So when we think of strong recommendation, there's 4 main pieces of the puzzle that we're going to go over today, and I do want this to be really unique to your practice and what you guys talk about day in and day out. Because if it's not applicable to you, then we don't even need to have the conversation, right? So I want to make sure that we're touching on what you guys talk about. But we're going to go over the why behind strong recommendations. We're going to go over how we can approach it as a team to make it a really layered approach to making these medical recommendations. What goes into the anatomy of a strong recommendation, like what can it sound like? And then we're going to go over what it can sound like in our own words as a group, again, for products, services, treatments that you guys recommend every day. Okay. Before I guess we've kind of already dove in, but is there anything from this presentation or this topic that anyone thinks, like, I really want to know this by the end of this presentation, or something that you guys know that you struggle with that you want to talk about? And it's okay if there's not. Nothing coming to mind. That's okay. So, the why behind a strong medical recommendation. In my mind, there's obviously patient care, right? Like we're recommending treatments because we know that it's what that pet needs. We also know that 80% of pet owners prefer to get healthcare information from their DVM or VHT. In this case, that means veterinary health team. So 8 out of 10 clients will say yes to diagnostics or treatment when the value is relayed. Okay? Now 80%, that's pretty high. That's a lot of people saying that they want to get the information from you. Do you guys ever run into maybe where that doesn't feel like the case and you're hearing a lot of, I Googled this, social media is out there.
Dr. Google.
Dr. Google.
My favorite.
I asked ChatGPT about this.
Oh God, I'm so glad I have not heard that yet.
There's a lot out there. Do you guys hear that?
Yeah.
Every day?
Every day. Or
Is
the
it-
breeder told them
Oh,
that.
yeah.
Oh,
These cats should never be vaccinated.
My friend's
uncle
yeah.
used to be a vet.
The RVT who has not been in the field for like 25 years.
The human nurses.
Oh, that one's fun too.
Yep.
Baby
Oh, yeah.
aspirin.
This is such a funny conversation. Yeah, there's a lot of places that people can get information. The breeder one just gave me PTSD a little bit. Like, if you vaccinate this dog for lepto, you will void your contract.
They will die.
That's a fun one. Glad that that's still happening.
Oh, yeah.
Oh yeah.
So, unfortunately, that does mean that you guys have even a little bit heavier of a lift in that we're now existing in a world where that is where people get their information. But we do know there are clients that still look to you, right, for that trust. Like Brian used the word trusted advisors. That's really what you are. And the reason why is because you are the professionals, right? We have knowledge, we have education, we have experience that they're looking to you for. So if I go to my personal doctor and let's say I'm going in for ringworm, okay, everyone's like most favorite thing. I'm going to the doctor and she does her exam, and if she's like, oh, Haley, I think based on, you were a vet tech, maybe this is ringworm, you can do treatment A, B, or C, whatever one you want to do, just let me know, and we'll do it. Now in my mind, I'm like, you clean this ringworm right now? However you do it, tell me what to do and I'll do it, right? Ringworm's really itchy. Do I feel like I trust that doctor if she's giving me A, B, or C? What is treatment A? What is treatment B and what's treatment C? Why am I going to the doctor if you're asking me to decide which option to go with, right? So that same concept applies here, that we need to make sure that we're leveraging our experience and our words to show that we believe in whatever treatment plan we're recommending because we're the professionals, right? We want people to go to you and not ChatGPT or their breeder contract or whatever that might be. So the benefits of making strong recommendations, and I apologize, this is a little small, so I'm gonna read them out. We know that pet owners are 7 times more likely to follow a recommendation when it comes with clear, confident communication. 7 times more likely. That was done, I believe, in a JAVMA study, or a study published from JAVMA, and it was also specific for dental recommendations and surgical recommendations, which you guys know, those are sometimes the hardest ones to get yeses on, right? Those tend to be higher dollar treatments. So that clear, confident medical recommendation can make a huge difference there. They're also significantly more satisfied with their veterinary care overall when they get that clear, confident recommendation from the VHT, from you guys. They're also, 80% of pet owners indicate that being educated by this team increases their trust. That's a big deal, right? The client hospital bond, just like the pet parent and pet bond, is something that we need to protect, right? And then in a study, the top 2 reasons for discontinuing treatment were lack of clarity on significance of OA pain and the necessity of continuous pain control. So that's why owners stopped giving therapy, right? Those were the top 2 reasons. Any questions, comments, thoughts on this? Does any of this strike you as like, that's interesting? That's 7 times. Yeah, go ahead.
I have a little story. I don't know if Dr. Mikovich can, I'm familiar to her, but I recently lost my dog and she was seeing her.
I'm sorry.
And the reassurance, I mean, I was blowing her up by email.
Yeah.
Just the reassurance of her saying, you know, Sandra, this is what we're doing and you're doing good. And we're still okay. But I would look to her like, you know,
Yeah.
what do I do now? Am I doing it right? And
Yeah.
a little bit back on what you were saying, it's just that lifeline. I just want to hear her say, you're being a good pet parent, you know, and you're not doing anything wrong, and you know, and so I get what you were saying, and it was just, I just wanted to hear somebody say it, you know.
Yeah. Thank you for sharing that. That's so powerful. Has anyone else been in that? Like I said, I turned into a client, right?
Yeah.
Has anyone else had that happen to them? Like it's all like this is a dog on paper until it's your dog.
Literally
right?
yesterday.
Yeah. What happened?
My cat got all his teeth pulled.
Oh.
And I was not having a fun time with it.
But he's gonna be.
No,
much
he's
better.
great. Dr. Pound is
He's
amazing. He's amazing. But it totally turned me into like pre-working here. Like, what do you mean? Should I move forward with it? Panic. So definitely felt like the same client that I have to be like at 7:30 in the morning, no coffee. It's okay. They'll be okay.
Yeah, my dog's getting a tooth pulled. Will he ever be able to eat again?
Yeah. He's gonna hate me.
And then suddenly when it's you, you're like, oh my god, will he ever eat again?
Exactly.
Thank you so much for sharing that. That's so important. That concept of I just want someone to tell me that I'm doing the right thing. I was in a practice in Austin not too long ago, and I sat in on an exam room with the doctor, and they were going over potential cystotomy. And she was recommending either you can do surgery or we can try the diet first. And he literally said, I came here because I trust you. Can you please tell me what to do? Right? Like that's a big deal
You just
too.
cling to them.
Yeah. So your clients are doing the exact same thing, and that they just want someone to guide them through that conversation.
What does Dr. Mikovich say?
Can I talk to her? Can I get her voicemail? What's her home phone?
Maybe not for the client. For you guys, maybe. Yeah. So impact and action, making a difference together. And we mentioned this already, but when clients receive that clear, confident recommendation, they're 7 times more likely to accept it. And they're overall just more satisfied with the care that they receive from you. So this one here, this is really just showing us how many pieces of the puzzle there are here and why it's so important to take a layered approach. So I know some of you have already heard me tell this story, but I know we're working on forward booking. My colleague Heather, she hates the dentist. She has actually said verbatim, I would rather get tased than go in for a cleaning. I'm seeing some nods. Okay.
I would rather have open heart surgery.
Oh, that's really extreme.
Okay. So you guys can empathize with the clients that are like, I don't know if I want to do that dental. So Heather, she went in to get her cleaning done. Obviously she was like, I'm not getting forward booked. I never want to come back here. The fact that I'm here is already a big deal. Like, just let me go in and go out. So her goal was to not get forward booked. And so when she went in, the dentist was finishing up the exam and said like, hey, when you go up front, they're going to get you on the books for next year. She's like, thank you so much. I'm not going to be doing that, but thank you. Walked up to the front with the hygienist on the way. The hygienist was like, hey, we're going to get you booked for your next appointment, your next cleaning next year. They'll help you get that at the front. And I was like, thank you so much. I'm not going to do that, but thank you. I really appreciate it. And she got to the front, and she knows the receptionist's name is Amanda. She says Amanda is just the nicest person in the world. And so when she gets up to the front, Amanda says, oh, Heather, I heard you got a new job. Congratulations. I know you're going to be traveling all over the place as a workflow specialist. I'm going to make it easy on you. I went ahead and I put you down for this time, this date next year. If you need to move the appointment, just let us know when you get the reminder and we'll help you. They got forward booked, much to her chagrin. She was not happy about that. But the key there was that every single person played a role in that happening. So do you guys ever, for like my CSRs, technicians, you guys ever say, oh, I'm just a tech, like I'm not the doctor, or like, oh, I'm just a receptionist? You guys ever catch yourself saying that? So, I want to go through like an example here. Let's say I bring Marcy in to you guys, and Marcy, again, she's 7, she's the cutest dog in the entire world. That is not biased, she genuinely is. And she has bilateral elbow dysplasia, so maybe I'm just going in for an exam though. I have that in my mind of like, you know, she might have some stuff going on with her bones, right, and her joints. But I bring her in, let's say CSR Tina looks at Marcy, she's like, oh my god, Marcy's so cute. She pets her on her butt, because that is what Marcy, like that's actually all she needs. She doesn't need to be fed, she just needs scratches on her butt. So she does that, we're chit-chatting, talking it up, and Tina notices that maybe Marcy is like sitting, yeah, they do that thing on the side with their head up front. And maybe Tina says to me, has Marcy always sat like that? Like, have you noticed that she does that at home too? And I like look at Marcy like, oh, maybe not. I'm not really sure. But the room's ready, so we go into the room, and then the tech comes in, and they look at Marcy, and she's still sitting like that in the room. And the tech says, hey, I noticed Marcy sitting on one side, on only one hip. Is this normal for her? Are you noticing that she's experiencing any signs of pain at home? Huh. Maybe. Like, her elbows do really crack when she gets out of her bed, and she doesn't jump into the back of my car as much anymore, but I'm not sure. And then by the time Dr. Brian comes in, he says, hey, my tech let me know that Marcy might be showing some signs of pain at home. We need to talk about OA treatment. Now, if I, as the client, am hearing that, and I've already been prepped and primed for that conversation, I'm now seeing that the entire hospital thinks that we need to talk about pain with Marcy, right? You guys are not just techs and just CSRs. How many of you in the room get owners, as soon as the doctor leaves, they're like, hey, what do you think I should do? Like, if Marcy was yours, like, would you do the rods, or like, can I wait on this? Do you guys get that?
Oh my god.
In what other situations does that happen for you guys? Because it used to happen for me with parasiticides, like the preventatives.
Yep.
I straight up should have worked for Chewy or whoever they wanted to go get that from. I have thoughts about Chewy, but anyways,
Everybody has
every single appointment, it would be like, or the dog food, right? What kind of food do you feed Marcy? What kind of preventative do you give her? Would you do a dental right now for your dog? You guys are all experiencing that, right? Yeah. You guys are not just techs or just CSRs. You're looked to as the professionals. You matter in this conversation. In every single role, kennel techs are not up here. Your kennel techs have FaceTime with owners though, right?
A little bit, yeah.
Yeah.
Do you guys ever get asked for a recommendation? I'm just curious.
A lot of the times I feel like the owners are like rushing and they just want to like drop their pet off
Oh.
and leave. So I don't really,
Or pick their pet up to go home.
yeah, so I don't really feel like there's a lot of engagement there. Sometimes they'll be like, oh, this is what we're feeding them, and they'll give you like, they'll write you a paper of like how they're feeding them, but other than that, I don't really feel like they ask too much.
Okay.
Well,
That's good to know.
yeah.
They're more like,
Yeah, it's kind of like, oh, we're leaving, here's their stuff, and then you're like, okay, bye, see you next week. Kind of, yeah.
okay, I gotcha. Kennel techs, because they are, you know, you guys chat with clients, like you're
Yeah.
talking with owners. I think that they should be up here, but we only have room for 4. But every single role in here, if we see it's highlighted, client education. Every single role deals with clients and plays a role in that client education piece, which I think is something that I forgot too, as someone who, like, I would always say, like, I'm not the doctor, I'm just a technician, right? You play a role in getting that owner to say yes, and that yes can mean the difference between a patient receiving care and a patient not receiving care.
Like with everything, education is priceless.
Yeah, I agree, especially when it's not coming from ChatGPT or Dr. Google. So if we think about those roles and how often you guys are chatting with owners, this is the facet of this that stood out to me the most. We have 4 different roles. In every single step of one appointment, they can have 6 touch points. An owner can have 6 touch points with you as the team. 6 different touch points in one appointment. And that can vary based on your workflow and your protocols. But just think, if every single role here, vet tech, vet assistant, or CSR, if we're not unified in what we're recommending as best medicine, if I ask them, like the roles here, if I ask them, what should I do for prevention? And I get Sentinel from one role, and then I get Heart Guard, Neck Guard from another, and then I get Trio from another, and then I get Diatomaceous Earth. Not saying you guys would say that. I'm just
And you're back on no trust.
So if that owner gets different recommendations from each role, what are they supposed to do?
They get confused, they don't feel like they can trust this one single person because there's too many recommendations being thrown at them. Because there's too many options.
It gets overwhelming.
Yeah, and what happens when you get overwhelmed?
You either A, don't make a decision and you leave without getting it, or mistakes are made, or you just feel pressured and you just pick one and just say, just do that one. And it may not be the best option for that pet.
It might be just the cheapest option.
That too.
Right? Yeah, usually we'll see neutrality. In that there's too many options. Like for my ringworm example, there's too many options that I don't understand what I'm getting out of this, so I'm just gonna go home and Google it at that point, right? And see what I can do over the counter or something. That neutrality though in vet med, I guess in any medical field, it's dangerous. If that patient doesn't take home heartworm prevention, what happens to that patient?
They could potentially get heartworm.
Yeah, I know I asked the doctors this the last time I was here, but do you guys see a lot of heartworm treatment cases?
Well, I have 2 that I diagnosed in the same day last month, but other than that, not really, no.
Sadly, correctly.
2 on the same day. Yeah, that was like, they were the first 2 I've had in a couple of years.
That's bad luck. Where did they come from?
One was just here, and then one came from Florida. Yeah.
Yeah. Or if they say no to annual lab work, right? And what are we missing? That neutrality is dangerous for the patients. So we want to help them make that decision, or at least understand the value of what they're saying no to, right? So that they understand what the potential consequences of inaction are. So we want to have that layered approach when we're talking about a strong recommendation. So how do we build it? Like, what goes into a strong recommendation that we can make scalable and repeatable so that we're getting yeses more often and expressing the value behind what we are recommending? We want to keep it strong and also simple. Simple is good. So there's, again, 3 pieces to this. Why are we recommending it? What actions do we need to take? And then what's in it for us? Like, what's in it for the pets and the owner? Okay, So anytime that we would make a recommendation, we should be talking through these 3 pieces. We also want to make sure that we're covering certain pieces of how to build that recommendation. So we know what we want to cover, but we want to know how to say it as well. So use powerful words. Let's use Marcy as an example again. And let's say that Marcy is coming in for a skin issue, like she's itchy, which she's not yet. Like I just put like really bad juju into the universe for myself, but that's fine. So powerful words. Words like recommend, should, and advise can add weight to your clinical assessment and make sure that the owner understands that this is what we think you should do. Right? In Marcy's case, maybe Dr. Tina, instead of saying, we could do Cytopoint if you'd like to, or if you'd like to, we can do a cytology today. That would be, I recommend that we give Marcy a Cytopoint, right? Or Marcy needs that cytology so that I know what's going on her skin before I can prescribe anything for treatment, right? Does that make sense? Yeah. We can also we do want to consider the options, but we want to make sure that we're offering the top one first, okay? So we want to use evidence-based guidelines to confidently recommend the care that we believe is in the patient's best interest. We want to be empathetic, so we know vet med, it can be expensive, right, to bring your pet in for a visit. We're always going to be empathetic, but we do want to make sure that we're offering what we think is best first. So in Marcy's case, if we think that she needs some kind of anti-itch treatment, I don't want to say, hey, we've got steroids, you can try antihistamines at home, you can try a shampoo, you can try Cytopoint, or you can try Apoquel Chew. What would you like to do? There's a lot of options. So as an owner, to our point earlier, they want to know what you think they should do. So let's start at the top and say, I guess I should have put cytology on there. I recommend we start with a cytology, and depending on what that looks like, we have options like Cytopoint, because I know it's hard for you to pill Marcy, right? We're going at the top first. Okay. We also want to tailor our wording. So we want to make sure that it's easy for them to understand. We don't want to use medical jargon to make it harder for the owner to really understand the value of what we're offering, right? Does anyone run into, like, you go over a treatment plan and then the owner at the end is like, I don't know what is that? What's a cytology again? Like, even the word cytology is technically medical jargon. I have a hard time reminding myself about that because we live, breathe vet med, right? We're all talking about cytologies and IMHA and like all these terms that are very specific to our field. We need to take a step back and make sure that we're messaging it in a way that makes sense at the owner level. Again, other people have heard me tell this story in this room, but I was in an exam room with a doctor who, it was some complicated like internal medicine case, and the doctor started going over her spiel in a way that was very easy to understand, like an explain like I'm 5 kind of approach. And the client stopped her and was like, hey, you can give it to me straight. I'm a doctor. So go ahead and list that out for me. Spent probably 15 minutes going over all of the very technical terminology, everything that went into this case. And at the end, the owner was like, could you actually go back to the way you did it the first time? My doctorate is in music theory. So I don't know what you just said to me. So when it comes back to the power of the recommendation, again, power in words, right? And value. They have to understand, I'm gonna go back for just a second. Like, what's in it for me and my pet? Why are you recommending this to me? We have to make sure that they understand that, of what's going into the why behind it. We also want to speak benefit first and then cost. So we established before we even really got into this conversation that the financial piece can be really difficult to navigate with owners, right? So if we lead with the benefit and that value before you go over cost, you'll have a better conversation that leads to a better level of understanding with your owner. Like that point of feeling like we're on the same team, us versus the problem. You can establish that by making sure they understand why we're talking about annual lab work or the radiographs or whatever therapy that is in the first place. Do you guys find that you already do that? Do you feel like you naturally lead with benefit, or is that a shift? that sticks out to anyone?
I think for me, it kind of depends on who I'm talking to. Yeah.
Okay, tell me more.
Oh, I mean, like some people, like clients who I know have, like who are watching their money. Like I always I recommended stuff, but then I'll be like, wait, this is this much. You know, like I'll bring it up faster. Like instead of
Okay.
like, oh, by the way, that senior panel's $300. I'll like, maybe we should
As
do
you're
this.
walking out the door.
Yeah, like, oh, we should do this, and it costs this much. It just depends on when I talk about money, like the client usually, or if they've come in and said, well, I don't have a lot of money, and all that kind of stuff.
Yeah.
It just depends.
Yeah, that's a good point. Because you do, you have to be mindful, right, of your owners, and that leading with empathy piece is key there, but you know your owners, like you know them and what they're gonna look for from you. But what I do wanna challenge everyone to think about is, and I know this is like common in vet med, but not x-raying their wallets, right? Like we don't know what the owners have available unless you happen to know, or they tell you. What'd you say?
Our clients very much tend to tell us.
Yeah, pretty frequently.
Pretty like right off the bat, like I got $100. What can you do?
Although,
That being said, I mean, you know, they may say that, and then all of a sudden you find something.
Of course,
Right.
I was gonna say, in the same thing in the dental world, like, I'll have people, when they come in and they had to pay $34 for their cleaning, and they're like, that's all the money I have, blah, blah, blah. And you find out they have a root canal, and that's the only way they're gonna clear it, all of a sudden they have $2,000. The root canal and crown. But, I mean, cause even when I go into any kind of situation, I am a cheap person. I am trying to find the cheapest way out of it. And so I will upfrontly be like, I'm poor and broke. What can you do for me? Because I know that they're gonna give me the best, deal, but it might not be what's best for, you get what you pay for kind of thing.
Yeah.
So I know in my experience, people will tell me how broke and poor they are, and then all of a sudden, okay, yeah, I do have it.
Yeah.
Because
I will say as a client, and again with Dr. Mikovich, one of the things that I really appreciated when it came to financial, and I got it from everybody as a client, kind of breaking it down, like, you just wanna say, well, let's do the chem panel, let's just look at it all, but like sometimes we talked about, but your dog's focus is on her kidneys, so, maybe we can just do a kidney function, and I can, base your medication off of that, and that'll be a little bit cheaper.
So what if we do something like that, but if we had done the whole panel, we could have caught something that would have saved a lot of money down the road. So
I
yeah,
mean,
you're paying
Nikki,
a
this
little
is
more.
like for long-term monitoring of chronic diseases, it's not the same thing.
I'm just
It's
trying
like
to
a
correlate the
yeah.
conversation, like in something else, like with Jade. She was older, and you guys were like, yeah, we need to do a wellness panel, and I was like, yeah, let's do the wellness panel. But had I not had that conversation with you, and I just came in and I was like, oh, she's old or whatever, and they're like, oh, well, we'll just give her an ear inspection and not go into the wellness panel and things like that you guys do offer and the reasons why. That recommendation made me consider that and make sure that now we have a baseline for Jade. And in 6 months or a year when she comes back, we'll run that and see if anything's changed. And so having, putting forward a little extra money in the beginning, right, could save us money in the long run. I just correlate it to dental because you do your x-rays at 6 months, you catch it when it's a cavity versus when it's a root canal, you wait 2 years, 3 years, and then all of a sudden you have a $3,000 bill versus you would have paid $60 for your filling if you would have done it sooner.
Yeah,
So
that
that's
makes sense to me too.
kind of what I-
Specifically in my case, she was already older.
Right.
It was chronic, it wasn't gonna change. And it was more about quality.
But that's a good point, Nikki, of that goes into that value. There's a lot of ways that we can look at this conversation, but expressing that this might save us grief, time, pain, money in the long run, that's a great way to approach that conversation. That's how I used to talk about lab work all the time,
Oh, yeah.
right? Especially lab work, that's a great example of we're not just doing this, right? We're doing it for a reason, and that value is X, Y, and Z, whatever that might be. That's a great thing to keep in mind. I also want to be very cognizant. I think this conversation can be a slippery slope into we should get our owners to say yes to everything and every time we need best medicine for every patient. That is not the point. That is not the point. You will not get that every time. Not every pet needs that, right? It's up to the doctor's discretion of what's best for that patient. but what I wanna help you all with is how can we feel confident that we are recommending best medicine, and how can I say it? Because even if you do hand, I've worked with a lot of doctors that are like, by the book, I'm gonna recommend best medicine to them, whether or not they tell me they have $5 or 5,000. And you, as long as you're expressing the value, that way you at the end of that appointment can say at least they know what I'm recommending, right?
They're educated.
They're educated. And they came to us for that knowledge, which is a big deal. We're protecting that trust. So you can always, I love asking my doctor, like my vet, like, okay, I hear you, but what would you do for if Marcy was yours? Like, what would you do for her if she was yours? And then we can go from there. But that's that whole, speaking to the benefit first and then cost, so that at least it's us versus the problem, and not now we're haggling over why the senior screen is X, Y, and Z dollars. Does that make sense? Yeah. Using visuals to explain the benefits, that's another big one. Do you guys have a place to draw in the exam rooms?
She had a
Real
question.
quick. Oh, I'm
No, I
sorry.
actually just had to say,
Yeah?
with the whole pitch, I yesterday had a conversation with an owner. She called in. She had been in earlier that day for a follow-up exam, and she was panicking because the dog had gotten into her bedside drawer and eaten half a bag of chocolate-covered pretzels. And she was panicking.
I was like, sounds good. I should keep mine there as well.
And she was telling me, she's like, I don't have that much money. What would you do? I told her, well, if we were able to see you today, it would most likely be an emergency exam. Which, if I could check right now, because if they just ingested it, we want to get this out ASAP. And she's like, I don't have that kind of money. And she started crying, she started panicking, she didn't really know what to do. She's like, I don't know if I should just monitor him. So I gave her the next best thing. I told her call poison control.
Yeah.
Could have been that they ate not enough to, do anything to the dog. And later on, she's just like, I don't know what to do. Should I call them? Should I not? Should I induce vomiting at home? And I said, don't do that. So then, eventually, I just gave her a plan. I told her, just go ahead and call poison control. If it starts seeming like they are recommending you come to a vet, start signing up for care credit. I gave her a plan, and she just said thank you. And then 20-30 minutes later, she gives me a call back, and she's like, they told me that it wasn't enough. They told me I could just monitor, and she just thanked me. And she just wanted to update me. And it just felt really nice to be able to see that, what you're saying, and also have experienced that just recently.
Congratulations. That's a big deal.
It was a win for my day.
I mean, I hope that's a win for, like, keep that in your back pocket.
Yeah.
Like, you helped an owner through trauma, right? Feeling like, oh my God, I can't pay for my pet's care. Something bad's going to happen if I don't do something. You walk them through that. I like that concept of having a plan too. You guys as a team, of course, can talk through, like, if not A, then B, right? And having that kind of a set guideline for that's a great idea. I love that. The visuals. Do you guys have a spot in the room to draw? Do you ever do that?
Just like on the back of the
Yeah.
exam sheet.
Okay. I'm sure those are great pictures.
Yeah.
Yeah, so actually the last practice that I worked at, we had whiteboards hung up in the room, and the doctors use them in every appointment. Sometimes I'm like, did you really need to draw that? Like the flea life cycle, or the heartworm life cycle, or sometimes even where the anal glands are, right? To express that. It sounds silly, but there is a lot of power in that visual. I think I maybe heard from one of you guys, the dental stages, like humans versus.
Oh, well, I have a previous customer in corporate and specialty. He developed what's called Pet Interactive, and it's a touchscreen TV to help educate clients on disease states, surgeries that you recommend, like TPLOs, heart murmurs, but it also goes over wellness type stuff like prevention for heartworm disease, Lyme, etc. So
Yeah.
my husband's at a clinic in Elk Grove, and he went and saw the demo. They brought it in, and the feedback from the doctors, this is phenomenal. They no longer have to draw a picture on a piece of paper or anything like that. So it's all developed by a veterinarian. And so he is just wanting to get the word out, like, hey, we have an option, instead of all this hard work that you have to do and drawing pictures and re-explaining, the videos help do that for you. So
So that's,
I heard from someone else too, a hospital had, like canine dental grades and like pictures of what each grade looked like, and then next to it, the human equivalent, which I feel like might speak to you. Because it's really hard to express that someone needs to get their dog's teeth cleaned when it's not that bad, right? But to your point of in the future, it might be pretty bad, like full mouth extraction bad, and really making that connection to this is just like why I go into the dentist every 6 months. So that visualization can be really useful as you have certain conversations with owners about different disease states. So there's definitely power there. In Marcy's example, if she comes in and she's like an itchy skin dog, seeing before and after pictures of a pet on, Apple when it first walks in, those dogs that are itchy, red, inflamed that you can smell from the door, and then 4 hours later, right? So that power there of, that might help me say, if I don't treat this now, it's only gonna get worse. I'm probably gonna need antibiotics and shampoo and therapy next time I come in. And seeing that with the visual can be really powerful. So you have tools in your toolkit to use as you have these conversations with owners. Any thoughts? There questions? Okay. So I thought, we have until 1:30?
1:30.
Okay, so we've got about 10 minutes. I wanted to walk us through, we just learned a lot of stuff, right, about what goes into a recommendation. So I wanted to try it for things that you guys talk about all the time. So if you had to pick, like in my mind goes to annual lab work almost immediately, because that tends to be expensive, and also is a long conversation about what goes into it, and it's recommended at like almost every annual. Is there anything that you guys want to try workshopping? Could be anything.
Spay and neuter.
Spay and neuter.
Recommending. Some people are really like, should I? Should I not?
Please take heartworm prevention.
Okay.
Because that's a big.
Spay and neuter, that's interesting. I would have never, so that tells me about your clientele. Is that a difficult conversation sometimes?
Sometimes.
Okay, I love that.
Just keep multiplying.
You said they keep multiplying?
The neighborhood cats, I mean, they don't get
Yes.
fixed, and so.
Totally.
Cat colonies.
10 to 20, and then, and then there's people there that are mean to them, and then I'm upset.
Aww.
Why do you get sleep at night?
Yeah.
They're meowing all night.
I hear a cat meowing, is it in a cage? I gotta find it. Yeah.
Okay, so when we think about spay neuter, and we can also talk about the preventatives too, because I think that's another hard one. If we look at this, the why, what, and the what's in it for me, why are we recommending spay neuter?
For female spay, so they don't get a pio.
Okay, let's stick with spay for this. So, why no pio?
What's a pio?
Pyometra is an infection of the uterus.
No babies.
No babies. No puppies / kittens.
Accidental litters.
Yeah.
We're gonna summarize that with the accidental litters. Why else?
Mammary masses.
Oh, that's a good one.
Prostate cancer.
Cancer, same. Ovarian cancer.
There you go.
I was gonna say, I need to learn a little bit more about anatomy, but
So if we think about what, like, the actions that we need to take here, what is that, how would you say to an owner what's gonna happen for that spay? Like, how do you express what it is?
removing the reproductive organ. Like, wait, literally, like.
How, right now, if I brought Marcy in and she's 6 months old, I'm like, what is a spay?
Oh, got it. Yeah, removing the reproductive organ.
Removing the uterus and ovaries. So she can't have puppies.
That's a surgical procedure.
I was like, wow. Whoa.
Let me get my laser pointer.
So it's a surgical procedure.
And it's going under anesthesia?
So surgical procedure
Okay.
under anesthesia
Okay.
to remove.
The uterus and ovaries. Or the girl parts that have been gone. Five or that.
The crown jewels.
I feel like that'd be more for males.
I don't know, we got some.
Okay, I love this conversation because I don't know if anyone noticed, there's a lot of variation in the room, right? That's just how we would express that, even from owner to owner. Baby parts, girl parts.
Some owners are like, okay, they may not really
Yeah.
know what the uterus and ovaries are. But like the girl parts.
Read the room, speak to your audience. But having, space a very niche example, because it's one conversation, but to like that point of that is that a layered approach that's consistent and clear from everyone in the room helps you express that value. So as we think about these things, having conversations about how do you talk about a spay, or like I used to have like a sub-Q fluid like spiel in my head of like this is exactly how I do it, this is what I tell them, and I train the rest of my team on how to do that. Like having the same plan can be really helpful. Do you guys already do that? Like do you talk as a team about this is how we say X, Y, and Z?
Here and there in passing, I've experienced, mainly with my client care girlies.
Yeah, but it's
Sorry,
more,
Drew.
more of like as a hospital wide. So like yes, in client care, but not so much hospital wide.
So you would get a different kind of description from a client care versus a tech versus a
ACA versus a doctor.
Sometimes I'll hear one word and I'll be like, that sounds professional, I'm taking that.
Like I love that one.
I love saying Dr. Odie said.
It's Dr. Rodney.
And I don't think it doesn't have to be the same. Again, to be clear, like we talk about standards of care a lot, and we hear a lot of like we don't want to be in a box. We want to be able to practice the art of vet med, right? Which is true. It's not about being the same. It's about being consistent and similar enough to where your owners leave with the same understanding, regardless of who they talk to, even a kennel tech, right? So let's keep that in mind. But I love this one. And then the last is what's in it for us? Like, why as an owner should I say yes to I don't know how much your spay is, but $1,000 spay? What's in it for us?
To prevent a PIO. That spay would be
The
like
longevity of your
$4,000 to
pet's
$5,000. It would be a very, very expensive procedure, and it would be very, very emergent. And trying to find someone who's able to do a spay on a pyometra right then and there can be not necessarily the easiest. So saving money in the long run, and also saving your pet from going through a traumatic experience.
Life-threatening. Yeah, life-threatening, yeah. Those are nasty,
Especially if they don't have a lot of money and they can't afford a PIO surgery
Or a C-section.
or a C-section.
Yeah, if you can't afford a C-section or PIO,
Just the
get
standard
them.
doctor.
You probably shouldn't have a litter of puppies either.
Right.
They're also expensive. So the other thing, if it's a spay, as an owner, does the owner understand what it's like to have to manage a dog in heat?
That's what I was just going through. I was just thinking, as soon as I found out I didn't have to deal with all that, I was down for that spay.
Because, in their minds, they're like, well, it's just on her period, right? Like, it's whatever. There's a lot that goes into managing a dog in heat. What other dogs do you have in the house? How do you feel about blood in your house, right? So dealing with a dog in heat, from the owner's perspective. Any other thoughts here?
And don't cats meow like incessantly when they're
Correct.
in heat?
Yeah.
Yes.
Until they get pregnant, yes.
That meow alone.
Okay, let's do one more really quick do you guys want to do prevention, like the parasiticide?
Yes.
Okay, so I'm just gonna write paras, that's easier for Haley to write. So why are we recommending parasiticides? Or are we taking gross? What'd you say? Worms or gross?
Worms are
are
very
gross.
gross.
Worms are gross.
To prevent having to pay for a treatment of some sort of parasite later on.
I had a lady, when she was there with her small child, I was like, that's really gross, you don't want that coming out of your kid's diaper either, so. Well, the kid had his hands in his mouth the entire time he was in the office, that was enough for me to know.
I'm
sorry, I can relate to that way too much because I have 3 boys.
Oh. And I remember like what made me decide, because I was a pet parent till I came here. Thank you, Dr. Mikefish. I didn't do like the shots to the lepto and all that, and then I started learning that that is transmittable, and especially to little kids. And I had my nieces and nephews over, and they're crawling around the floor. So the whole like transmitting into humans and being able to make my nephew sick just by him being in my house, that was enough to make me do that.
That's true. I just had that conversation with my sister who just had a baby. I was like, your kiddo's not on any preventatives? And then she tried to argue that there wasn't anywhere she's at, and I Googled that. I was like, here's a number.
She in a gated community.
Yeah.
He only goes outside the backyard.
He only goes outside to go potty.
Anything else for the why? Like, why should I take home? Why should I do ProHeart?
To prevent heartworm.
Prevent disease. Yeah.
Yep. For the pet, right?
To
Your
avoid
pet's health.
having to pay for it in the future.
Like flea prevention is often partly a diagnostic, or at least you're working. I say let's check flea allergies off our list and just make sure they're under flea prevention, so we don't have to worry about that part of it.
Yep.
If they're
That was not
itchy.
Yeah, that's your diagnostic tool. What action, how would you describe what, let's say, let's just use ProHeart. Like, how would you describe what ProHeart is?
It's an annual injection for heartworm preventative, so you don't have to give it on a monthly basis. So it's once a year. It's more compliant for some people who forget to give their pets their preventative every month. Yeah, probably.
That sounded really good, but all I got was annual injection. Annual injection
To prevent heartworm, and then it kind of goes into the what's in it for us is people who are not necessarily the best at giving a monthly preventative,
Or their dogs don't like to
or
eat it.
or their dogs will not eat it. It's an injection once a year, and they usually will get a reminder in their email and text, or you forward book it a year in advance.
Right. So you're hitting on, I like that too because you hit on both of those, right? Like you explained what it is and then immediately went into, this is why, this is good for you and your pet. Like Marcy she gets like interdigital dermatitis on her feet in the summer, and so I usually give like a little bit of Alpiquel for that, like a couple days worth, 3 days worth. And every time before we had chewable, I would have to be like Steve Irwin and like crocodile hunter, like like mouth open.
Yep.
That would be a huge selling point for me for Cytopoint versus Alpiquel, right? As a pet owner. In my mind, I'm like, well, I'll take whatever you're recommending that works, but if I knew that there was an option that works as well and fits better, that there's more value there for me, I'm going with that one, even if it is a little bit more expensive, right? So lead with that value first. That's a great call out. Thank you. And I know we're at time, but I just wanted to express, like, you guys can do this for anything that you're talking about. The key is that you're leading with value, you're believing in what you're saying, right? Leading with conviction, and you're using this kind of equation to make sure that you're covering all of your bases, and that at the very least your owners know why you're recommending it. Right? Any last questions as we comments?
Thank you for doing this.
Yeah.
You're so
Thank you.
welcome.
You did a wonderful job.
That's so sweet.
This is why you got into it, right? It's all the applause. Yes.
One